so this evening, we have our guest presenter is Will Simpson. He is the program director for the Violence Reduction Initiative that is sponsored by Equal Justice USA. He is one of our members. And to that point, if we have members who are doing great work, we have no problem putting you in a presenter's position so that you can share your information with our general membership. And so I would ask Will, can you come on the screen, please?
I think I should be on. Can you see me?
Yes, absolutely. Okay. So Will, you're going to need to say a little bit about yourself and, just talk about the initiative and what you're doing and the work that you're doing.
Sure. President Gregory, thank you so much for inviting me to the space this evening. I hope I'm coming through loud and clear for everybody. It's great to be with so many folks that I've known pretty much my entire life that are on this call here today. Here to talk a little bit around the work of Equal Justice USA. Again, I lead our violence reduction work nationally. But what I want to do today is, one, share a little bit about the organization, talk about some of the work that's happening in Newark, and then kind of scale up a little bit and talk about some of the opportunities that we've got here in the state of New Jersey around really reducing violence through supporting community-based violence intervention efforts. And my hope is, if technology works well for us, I have a short video that I like to play that kind of talks about some of the work happening here in Newark as well. So with that, I'll go ahead and, again, Equal Justice USA, right? A national organization that works to transform the justice system by promoting responses to violence that break cycles of trauma. We work at the intersection of criminal justice, public health, and racial justice to elevate healing over retribution, meet the needs of survivors, and advance racial equity and build community safety. A little bit more about the organization. We were started back in 1990 as part of the Quixote Foundation, and actually spun off in 2008 to be our own org. And for a long time, we really fought nationally and in state campaigns around the repeal of the death penalty. And then shifted, I would say probably about 10 years or so ago, to really look at how do we really transform the community safety paradigm, criminal justice in our country, and really expand the work that we're doing nationally. Some of the program philosophy around EJ USA is, for so long, right, justice has equaled punishment. But believe it or not, it's not just enough, right, to just reform parts of the criminal legal system. We've also got to be building new systems within community that actually support safety and well-being of our neighborhoods, of our cities. And so with that, a lot of the work that's been done to date in Newark really started around supporting survivors of violence and organizations that were doing victims assistance work. And that's kind of how the organization first started engaging here in the city. Since then, we have really focused on a lot of policy issues around public safety here, working with community members, the Newark Police Department around the consent decree and policy revisions there, working with our LGBTQ community to initiate and develop policy focused specifically around that community, as well as engaging community and law enforcement in a workshop that we call Trauma to Trust. This has essentially been our flagship program here in the city for about 6 or 7 years now. And it really focuses on bringing community and law enforcement together to have what sometimes are difficult conversations, right? We know that the relationship between community and law enforcement hasn't always been one that has been positive, right? And in some cases, the relationship has never existed. So what I like to do, again, if technology allows me to make this thing work, is share a little video that we were able to create around what Trauma to Trust looks like in the city of Newark. And then after the video, I'm going to dive into some of the opportunities that we've got actually here in New Jersey during this legislative cycle. So Ms. Gregory, I'm gonna go ahead and try and make this work. I'm sharing my screen.
Okay.
All right, everybody get your fingers crossed. Can you all see my screen right now?
Yes, we can. You can just.
All right.
Yep.
We're doing it. I'm gonna press play. Let me make the screen large. I'm gonna go ahead and
Yeah.
press play. If I could just get a thumbs up if you can hear.
Thumbs up. We can't hear it.
Said you can't hear?
No, we don't hear any sound.
Okay, give me 1 second. Now?
No. No.
Okay, 1 second. I'm just trying to.
And you're not muted.
People who love
There
their
you go.
community,
Yes.
people that are
Can you
passionate.
start it from the beginning, please? Thank you.
Newark is a beautiful, vibrant city, full of culture, full of people who love their community, people that are passionate. The people who live here, they are invested. The people who work here, the people who have loved ones here, they are invested in the well-being of this city.
Back in 1967, we had the Newark Rebellion. That really was a tipping point, I think, for our city to really realize that, hey, something has to be done differently. And ever since then, there has always been a level of activism that says, hey, we belong in our city and we're gonna have conversations and we're gonna have the hard conversations. And I think EJUSA was able to identify the right time and the place where we have a community that's ready to talk about the traumas that have impacted them for so long. We had a law enforcement agency in the Newark Police Department that was actually ready to participate in the conversations as well.
Again, Equal Justice USA came in at a time where the city was having issues and troubles around its policing. And so they really brought in a notion that we don't need to reform, that we need to make transformations. We need to transform.
So Equal Justice USA has been a partner with us through this reform process. We were looking to get community discussion and community feedback for both policies and trainings so that the community could have a meaningful voice. It's not something that as police officers that we could conceptualize on our own. So they've been an incredible partner through that.
And so when we bring community and we bring law enforcement into the room together, it really breaks down the dynamic of the us versus them. It really starts to make and force and forge a relationship that hasn't happened before.
And don't judge minorities or black people or whoever is in your community based off of the last person. I mean, that seems pretty elementary.
The moment I put this on and walk up to somebody, I already got a preconceived notion of how I'm gonna act.
Because you keep telling me, he keeps telling me that you're just seeing the things on the news, but that's not true. It's somebody else. But it's a cop at the end of the day. It may not be you, but it's a cop, and it's cops.
There's something really beautiful happening here. And I'm not trying to harp on the point, but we're right there, where we're starting to see each other's experience.
I think this is the core of building a strong connection with your community, right? You have to kind of go to the other side and have a conversation that may not be comfortable at the beginning because there are a lot of scars there, right? And the only way to kind of get past that is to sit down and just talk.
For people who don't know about EJUSA, they have been able to transform pain into purpose. They've been able to transform trauma into power. and to empowerment for people to be able to see themselves in a place that they've never been able to see themselves before.
We're talking about really changing the culture of the agency. And if you're going to do that and sustain it, you have to have, I think, this trauma-informed approach. You have to have some vehicle where the officers are better able to see folks in the community and better able to communicate with them. And I think trauma to trust is absolutely essential to that, to having those results.
The trauma never necessarily goes away, but that trust now elevates and comes to the surface and becomes a bridge, a building block for meaningful transformation to happen. So that's where that trauma to trust comes from. It's like a movement, a progression from trauma to trust.
I want to thank y'all for sitting here with me for the past 4 minutes and 30 seconds, just learning a little bit around EJUSA, the work that's been happening here with Trauma to Trust. And I talk about Trauma to Trust this evening because we're actually in a season where Trauma to Trust is happening, right? So we're actively engaging community, asking folks to come out and participate, working with Newark Police Department to sit and be a part of these conversations. And these conversations, they're not like a 1 hour conversation where we seek to make a whole lot of transformation, right? These are 2 days, 8-hour sessions per day that we actually have difficult conversations, and we start, right, as to where law enforcement began in this country, some of the harms, right, some of the impacts that law enforcement has had on Black and brown and marginalized communities, and work to start building that trust. I will also say, and I will put my email in the chat in a second, if, like I said, we're recruiting, and what we love for Newark residents, greater Newark residents to actually participate. And one thing that we actually started doing, I would say 2 years ago now, is we acknowledge the fact that when law enforcement comes to the space, right, a lot of times they're there when they're on the job, or they're getting time and a half and overtime to be present, right? And for a while, we were just asking community to come. But 2 years ago, we started stipending community to actually participate and honor the experience, right, of community, to actually be in the space and really value the wisdom that community brings in. So again, I'll put the information in the chat on how you register or contact me. We can get you connected with our team here. I'm just looking quickly in the chat. We can absolutely have more of our staff, just engage when we do in-person events. Make sure Ms. Gregory will get you the information. So folks know what's going on with EJUSA here in the city. But outside of Equal Justice USA, outside of the Trauma to Trust work, EJUSA has its hand in several different spaces. I'm going to talk about 2 more places here in the city that we engage. One is really supporting the development of the ecosystem of public safety. One where, we're really centering community and understanding that violence, right, isn't just the absence of, safety isn't just the absence of violence, but it's really the presence of well-being, and building the infrastructure to support that. So I know in the past, right, you've had the Newark Community Street Team on, one of our premier community-based violence intervention organizations here in the city. They're doing amazing work to reduce violence in a relationship-based approach, right, engaging with those that are closest to the harm. You've also had Director Keisha Yuri from the Office of Violence Prevention and Trauma Recovery here to talk about what that work looks like. And tomorrow, urge everyone to check out the mayor's Facebook Live, I think at 5 o'clock. Well, she'll be on there with the police director to talk actually about what the plans are for the summer. But EJUSA, we supported the development of the strategic plan for the Office of Violence Prevention, and really the thinking around how we're bringing all of our organizations together, not just law enforcement, but folks that are focusing on housing, right, education, doing community-based public safety, public health, to really build alternative strategies to reduce violence, not just always calling on law enforcement. And I think when we talk to law enforcement a lot, there's an acknowledgement, right, that we're not going to arrest our way to safe communities. We've actually got to build the infrastructure that is actually creating this sense of safety that for a long time we haven't invested in. So that's one way that we've been supporting the local Newark ecosystem as it develops around safety. And then the second piece is really like a statewide kind of endeavor that we kind of embarked upon, I would say, early 2017. And that's working with community-based violence intervention and prevention organizations around the state to build the New Jersey Violence Intervention and Prevention Coalition. So back in 18, we were able to actually get a statewide fund introduced at the state legislature to create a space for investments into community-based public safety. That first year, we just got the fund started, right? Nobody said, hey, let's put a whole bunch of money in there. So we had to get back to our organizing and advocacy roots and really begin to build power within community to urge our legislators to begin to invest in this work. So starting in 2019, we saw real investment begin to go towards community-based public safety in the state. The first investment was $10 million. There was another $20 million investment to hospital-based violence intervention programs as well. And every year since then, we've seen this state investment into this work. Currently, the dollars go to the New Jersey Violence Intervention and Prevention Fund that sits at the Attorney General's office, and then gets distributed throughout the state. So I believe last year we saw 20 different organizations actually get funded to do community-based public safety work from Paterson, New Jersey, all the way down to Camden. We've seen recently there's 9 hospital-based violence intervention programs operating around the state that are getting state dollars as well as federal dollars to really enhance what safety looks like in the hospital setting. And I'm gonna stay here for a second because a lot of folks may have heard the term hospital-based violence intervention and prevention, but really want to name what it is, right? So we know when folks are injured due to a gunshot wound, the first stop is usually the hospital, right? And a lot of times the doctors will treat them. It's like treat and release. We patch the wound up and then we're sending the people back out. But what hospital-based violence intervention seeks to do is connect with victims of violence right there at the bedside. So after they've been treated for, the almost fatal, near fatal wound, we acknowledge that this is probably one of the most traumatic experiences that they've been through. So how can we get somebody that has either been through that process before or is connected in a way to community to begin to engage that individual in understanding how they got here, right? What was it that led to the circumstances of now you being shot or harmed in an egregious way? And what can be done while in the hospital to connect you to services, right? Whether that's follow-up supports for your physical wounds, mental health supports, right? Or even things like housing. How do we connect you to those services there? And then I think the key part is understanding how can we mediate any conflict that got you here in the first place? And that's why I think organizations like the Newark Community Street Team and others, the outreach teams from the Office of Violence Prevention are so key. Because what we see, right, is when somebody gets harmed in the past, they go to the hospital, come back out, and we see a high recidivism rate for those that have gunshot wounds and then get back into the hospital for another gunshot wound. But what we've seen when we're able to kind of have an intervention point in that cycle of violence, we're actually able to stop that cycle. And so all across the country, we've seen major successes when HVIPs, right, hospital-based violence intervention programs, are actually able to intervene both in the hospital, but then in the community to reduce those levels of violence and trauma. So they have been highly successful. And so over the past 3 or 4 years, we've seen these increased investments into community-based violence intervention and prevention. And as Ms. Gregory alluded to earlier, June is actually Gun Violence Awareness Month. And so we see this as an opportunity, the coalition, to really lift up the power of community down in Trenton around reducing violence and what successes look like. So on June 15th, frontline violence intervention and prevention organizations, members of hospital-based violence intervention organizations, both state and national advocacy organizations around gun violence will be descending upon Trenton to rally support for a series of bills that would really increase safety around the state. And we're at a point now where we have invested a decent amount of money into community-based strategies, not nearly enough, but we need to make sure these investments continue. And as violence, right, spikes during the summer, we got to make sure that these dollars that have been allocated, right, don't just stay in a state budget somewhere, but they actually get to communities that are able to do this work. So I'm going to share my screen one more time, not for another video, y'all, so don't worry about that. But I want to share just a little bit around what some of these pieces of legislation are. And I will put in the chat for those that are on the computer to follow along as well, a link to the Violence Intervention and Prevention Coalition website. And what I'd like to do is just briefly kind of walk through what some of the legislation is and why it's so important to the work. And so the link is in the chat, and if you scroll down, you'll see some graphics. But I'm going to walk through what's up for the consideration, that section there. So the first bill that we're really pushing is A2049, and this is a supplemental appropriation of $10 million to fund community-based violence intervention. I talked earlier around how we've been successful in advocating for investments into this work, and we just want to make sure that those investments continue. Governor Murphy has already put $10 million for this work in his proposed budget, actually $15.5 million, but I'll get to the extra 5.5 in a second. To actually support this work. So we want to make sure our legislators know how important this work is to community and that they need to ensure that that money is in the budget. So that's A2049. The next piece is S2007. This is really, really important, introduced by Senator Troy Singleton and Senator Ruiz. And this bill requires Medicaid coverage for community violence prevention services. And it also requires the Department of Health to approve training and certification programs for violence prevention professionals. I talked a lot about HVIP a second ago, and this would go a long way to helping covering a lot of the costs that a lot of our hospital-based violence intervention programs are actually seeing. Because we know so many folks that go to the hospital are eligible for Medicaid, and being able to use those dollars to support their healing journey, both inside and outside of the hospital, will be huge. And this is what we've seen nationally, right? We've seen places like Connecticut, Maryland, begin to introduce this legislation to make resources more readily available for hospital-based violence intervention programs. Next, we go to Senate Bill 2295. That authorizes creation of a local civilian review board to review police operations and conduct. I don't probably need to say it on this call, but we see this as critically important. As we talk about building ecosystems of safety, it's important that accountability is real for everybody within the ecosystem, right? And I think we've seen here in Newark what some of the possibility can be with a CCRB, but Newark shouldn't be the only city in our state that is going down that road. We need to ensure that we have dollars to actually do things on a state level and make sure all of our communities have the opportunity to eventually get to a place where we have CCRBs that have subpoena and investigatory power.
Does that particular piece of legislation have subpoena power? Does it have subpoena power in it? Is it asking for subpoena power in it?
I don't believe it is, right? But I think this is a first step to get there, right? That's I think more local kind of ask for each jurisdiction, but definitely something that we want to see, right? But I think we see this as a step towards the right direction. And I know this is something that is being led by some folks on this call, but also New Jersey Citizens for Accountable Policing, as well as NAACP as well. Another bill that we've been looking at is S3086. So since this work has started in the state of New Jersey, it has been running out of the Attorney General's office, the community-based violence intervention work. And what we've seen, while intentions have been great, the bureaucracy and some of the challenges of working through the Attorney General's office is, one, they are not familiar with this work. And two, it's just getting money out of the door has been a continuous issue to making sure that, you know, folks are able to do this work in community. And what has been proposed is the creation of a division of violence intervention and victims assistance. And we see this as really instrumental to ensuring that, one, the bureaucracy is kind of put to the side a bit, and we can have folks that actually understand what violence intervention work looks like and really begin to staff it up with folks from community that have been in this work. And so Governor Murphy put a $5.5 million ask to actually start this office up. So the office has been started, but we want to see more funds go to that office to make sure it's staffed in a way that community deserves. And understanding that if violence intervention work is happening through this office, we got to have folks from our communities that are part of this office, and that we actually have, again, a level of oversight to make sure they're doing what they should be doing with those dollars. I want to also lastly talk about A5326. And this appropriates $10 million to establish a community crisis response advisory council and a crisis response pilot program. We see this, again, as key to really creating safety within community. Some of you may have been aware back in earlier this year, a young man, Najee Seabrooks, who worked for the Patterson Healing Collective, a hospital-based violence intervention organization operating out of Patterson, was actually killed by law enforcement during a mental health crisis. And we've seen nationally, when folks are in mental health crisis, not just here in New Jersey, but around the country, we see higher rates of fatal violence coming from law enforcement. And so what we want to see is when folks are in that period of mental health crisis, that we're actually sending folks that can de-escalate, right? That can provide the treatment, the support that individuals need to walk away alive from that encounter. And so what we're asking for is the creation of this community crisis response pilot program where we can train, right, community members, community-based organizations that are doing community-based public safety work to be a resource that can be tapped in the midst of mental health crises. We have arrived together at the state level. And I think that's a first step, right, towards reducing some of the harm that could take place. But we also know co-responder models still show up with law enforcement. And sometimes that law enforcement showing up with a badge and a gun can be an escalatory situation. So in this bill, we're seeking to establish, right, a non-carceral crisis response team where we have trained public health professionals that can arrive as well. So again, we're going to be down in Trenton June 15th from 11 to about 1 o'clock. Advocating on the steps of the State House for our legislature to support these bits of legislation and ensure that we're actually creating real safety within our communities through investments into community. What I will do now is, if I could find the chat here, I'm going to put in just one flyer that kind of lays out our advocacy day and gives a little bit more information for those that are in the Zoom. And Ms. Gregory, I can share this with you so we can actually get it out to those that are on Facebook and in other places. But again, Thursday, June 15th, 2023, we'll be down at the State House. And here's a list of the legislation. And if anybody would like more information about the ongoings of the work of the coalition, please feel free to visit njvipcoalition.com for more information and ways to stay engaged with the work happening here in New Jersey. So I've been going on for probably longer than I needed to, and I'm sorry.
But you know what? We need to receive the information, right? It's one thing for the work to be done, and it's another thing for us not to know what work is being done. We know that gun violence is up in Newark. We know that, but we don't know what actions are being taken. And there's a tendency to say that it's a police matter and what are the police doing? But you're showing that community-based public service safety is not just what the police are doing. And in the case of Najee Seabrooks, it's the young man was not allowed to de-escalate. And so my question to you is, the discrimination piece that comes in, it still plays a part. Racism still plays a part. How have you all managed to navigate that? And I also wanted to say that one of your team members, Dominique, is on as well. So you may want her to address us as well.
All right, I want to answer the first piece, right? I think Patterson is just a good example of what community power can do when we come together, right? So we had this tragedy, the shooting death of Najee, and to your point, Ms. Gregory, right? Like those at the Patterson Healing Collective that are trained in mental health crisis response, who actually train Passaic County officers, were not given the opportunity to do their work, right? These are the coworkers of Najee. And so we understand that there was some bias, right? That showed up that day in Patterson. But what we also saw is community coming together and call for, some oversight, some accountability. And I want to say maybe 2 months ago now, the AG's office actually responded and made sure that, something would change in Patterson. And so the AG's office came in and took over the Patterson Police Department, and they're undergoing waves of reform now that hopefully lead to transformation in the future. But we still got to stay accountable, make sure that they're accountable, right? Just because the AG's office is there doesn't mean it's time to pull back and not pay attention and just think things are going to be great. So keeping the pressure on, making sure that we're telling the story of not just Najee, but how this work is effective, right? And how that when we invest in these community-based strategies, we're actually creating safety that, you know, really means safety for community, that it's actually bringing that presence of well-being, not just arresting folks and then hoping that then violence will be reduced, but we're actually creating opportunities to enhance healing for our communities. I want to also address President Gregory. There was just a couple of questions in the chat.
Yeah.
I see Chairman Robinson asked, would if we'd be willing to participate in the upcoming Newark and NAACP Summit with Rutgers? Absolutely. Rick, I would connect you, and you already probably are connected with Zaid Muhammad, who is our Newark strategist, as well as members of our Trauma to Trust team who are absolutely willing to engage in that conversation. And Ms. Williams-Harrington, I see your question here. If you know someone who has been a victim of gun violence for a second time, how do you get them involved with your program if they are willing to participate? So we don't necessarily do the direct service. We really support those organizations that are doing that frontline work. I would urge you to connect them either with those two organizations that I mentioned earlier, the Newark Community Street Team or the Office of Violence Prevention and Trauma Recovery. And again, I could put my email address. Let me just do it now instead of keep saying I'll do it. Email is right there. Please feel free to email me. And Ms. Gregory, I can also, if you don't have them already, I know the street team came out with a new response number, right, for situations just like this, so we can actually stay informed as a community and connect them with services that will actually be supportive for folks that have been through some of the traumas that folks in our community have experienced. So I saw a couple questions in the chat. I see Mrs. Smith, you've got your hand up as well.
John, you had a question.
You're on mute.
I was talking. Hi, Will, how are you? Thanks for your presentation. Is Equal Justice USA in meeting with the different directors and chiefs across the state that when police is called and it's a mental health crisis, are the police letting the community team members intervene instead of saying, you know, I'm the police and, you know, we're in charge here because this is an emergency situation. Are you in conversation with the chiefs in reference to those type of situations?
So unfortunately, we are not directly engaged with like associations of chiefs around the state. I think that is why we are actually pushing the bills to create these non-carceral crisis response teams. Because I think when we look at Patterson, that's what didn't happen, right? Those community members that have been trained, professionally, that actually do training for law enforcement, weren't allowed to step in and actually do their work. So our hope is with the passage of the bill that would allow A5326, that would allow for the creation of this pilot program, it would actually give communities, not just in Patterson and not just in places like Newark, the ability to actually begin to create organizations of those trained public health professionals that would be able to do that de-escalation work that you're talking about, Mr. Smith.